This is an algorithm. I don't know how many are familiar with it or not, but just briefly, it's based on Dr. Pimentel. He's our lead researcher in SIBO, our main publisher, doing all the research. And he created a SIBO treatment algorithm that he published in 2006, which so many people don't even know was published. And then myself and my co-teacher and partner, Dr. Shivan Sarna, we took his algorithm, Dr. Pimentel's, and made this variation. And because we added a few things into it, we added in herbal antibiotics and just clarified some of the steps we were all doing. So let me just take you through it. So, and I should say, before Dr. Pimentel published his algorithm, he had published studies on all the various steps, and he had validated it that way, as well as with patients for about 10 years before he published it to make sure it worked. So first, obviously we suspect SIBO based on symptoms and history. And what most docs will do, or practitioners will do, is before we even know what's going on, just based on digestive symptoms, we'll try, supplements and dietary changes and things like that to see if that doesn't take care of it. If it does, then great. But if it doesn't, then we move on to trying to more so figure out what it is. So for SIBO, we would do a 3-hour lactulose breath test. We could also do fructose as well. And that helps us diagnose the condition. And once we have the diagnosis, we choose our treatment based on the gas types and how high they are. And our main antibacterial treatments that we use are pharmaceutical antibiotics, herbal antibiotics, and elemental diet. Elemental diet and antibiotics are a 2-week course, sometimes 3. Herbal antibiotics are a 4-week course, sometimes 6. I've got diet over here on the side, sort of without any lines to it, because we can use it anywhere along the way. And we often bring it in for support. Our main use of diet is for symptom help. Mainly it helps with symptom. And our second use for it is to help prevent relapse during the remission period. So anyway, then let me see if I can make this into a... No, I'll just use my cursor as it is. In the middle right here are prokinetics. After we finish our antibacterials, we get someone on a prokinetic. That's a motility agent that helps move the migrating motor complex of the small intestine. That's our main physiologic prevention against SIBO. It sweeps bacteria out of the small intestine into the large. So we want to make sure that's activated while we assess. So then we assess. On the left, let's say someone's, my goal is 90% better in terms of symptoms. If that occurs, I don't usually retest, and then we just move on to prevention, which includes diet, prokinetic, and some other things. Now, going over to the bottom right, what if they're not 90% better in their symptoms? That's the perfect time to do a SIBO breath retest, which is what I'm going to be talking about today. That's my topic today. And when do we do that? Within 2 weeks of finishing antibacterials. This is one of the most common questions we get. You don't want to wait too long because it's so common for people to backslide or sort of like relapse, so to speak. It's really more like backsliding at around 2 weeks after they finish their treatment, if we're not done treating. Because if we run a retest and they're positive, that just means we need more rounds to treat. And what you can see here is we say retreat down here, and there's a big arrow that goes back up around. So if you didn't know, because SIBO isn't like an acute infection, it's more of an overgrowth, more like a chronic infection picture, although not always. We often need multiple rounds to get it gone. We just have to keep, tapping it down until we get it gone. Now, let's say that you do a retest, they still have symptoms. What can happen is the test is negative, which means the SIBO's gone and those symptoms are from something else. And then we have to figure out what is there that is causing those symptoms. And then the last thing is all the way on the bottom left over here. Let's say someone, was all better and you've got them on some preventative treatments. The situation is that statistically about 2/3 of SIBO cases are chronic recurring with relapses. And that's primarily due to the fact that there are many underlying causes that have no known cure, such as diabetes, scleroderma, Hashimoto's, and food poisoning, which is what Shivan was mentioning, where she has positive antibodies. So anyway, let's say someone relapses, then that is the time to figure out what is the underlying cause. Can it be gotten rid of, right? Because if we can get rid of the underlying cause, we can get rid of the SIBO. And then we retreat the relapse. So that is the algorithm in brief.